watching Voice of South Asia. Welcome to Health Talk. मैं हूँ Nausheen Mulebred. अमेरिकन एक्ट्रेस मे वेस्ट ने कई सालों पहले कहा था कि यू आर नेवर टू ओल्ड टू बी यंगर. हमारे साउथ एशियन कल्चर में अनफॉर्चुनेटली एज के साथ आने वाले हेल्थ चैलेंजेस को वक्त का तकाजा समझ के एक्सेप्ट कर लिया जाता है. साइंस की नई टेक्नोलॉजी ने उन्हीं हेल्थ चेंजेस को रिवर्स करके हमें अच्छा फील करने और अच्छा दिखने का मौका दिया है. आज के एपिसोड में हम उन्हीं ट्रीटमेंट्स की बात करेंगे जिनको करके आप अच्छा दिख सकते हैं और अच्छा फील कर सकते हैं, no matter how old or young you are. We have Dr. A.D. Tucker here with us today. Welcome to the show, Doctor. How are you?
Good. Thank you for having me.
Thanks for joining us. आपको डॉक्टर साहब का इंट्रोडक्शन हम देते चले. डॉक्टर ठक्कर is board certified in emergency medicine. He's also the attending physician of aesthetics at Youthology Med Spa. He has 20 plus years of experience in the field of medicine. डॉक्टर साहब ये बताइएगा कि we all know aging comes with hair loss, and hair loss comes with lack of self-confidence. You look older, you don't feel good. What causes hair loss in men?
So there's many different causes of hair loss, which hormonal hair loss is the most common, and that's the one that we can often do something about.
Okay.
That's called androgenic hair loss, and so it's the way testosterone affects your hair follicles.
So has it something to do with when they say male pattern baldness, and
Correct.
so that's something to do with your hormones?
Yes, it has to do with how the hormone affects the base of your hair follicle.
Right. And what about women? What are the main causes?
So women also have testosterone. You know, it's about the 10th of the amount that men do.
Okay.
So they can also suffer from that type of hormonal hair loss. But there's a lot of other, just in men and women, it's not just hormones. You can get it from different vitamin deficiencies or other hormones besides the testosterone and estrogen levels. You can get it from low thyroid levels or extremely high thyroid levels, vitamin D deficiencies. Of course, stress can have a role in it. So infections, there's different causes of different types of hair loss.
So the next question I want to ask Dr. Tucker is, what are the treatments available in the market for hair restoration and rejuvenation?
So, one of the things that we do here is something that's called PRP. I don't know if you've heard of that. It's called platelet-rich plasma, which can be used for a lot of different treatments. But in hair loss, essentially what we're trying to do is increase blood flow to your hair shaft.
Okay.
And so the way that's done is that we take your blood, we spin it down and get the top layers of the blood, which is called plasma.
Right.
We take out your red cells and white cells, and then in there's platelets. That's why it's called platelet-rich plasma. And platelets are full of growth factors. And so, like skin and hair, we need growth factors to have our body do what it needs to do, because a lot of the time, to get healthier, thicker hair, the blood flow is so important.
Right.
Of course, affecting your hormones and all that we discussed earlier, and controlling those helps. But this will help increase a lot of times hair thickness by 20 to 30%, and actually the number of hair follicles by 20 to 30%.
Oh wow! So
Yes.
number of hair follicles also increases at the same time. It's all caused by the blood flow.
That blood flow, yes.
Okay.
And so when we inject that PRP, that's what I'll use for short, platelet-rich
Right.
plasma. When we inject PRP, essentially the platelets, the easiest way to think about it is they crack open like eggs, and from there release growth factors, because our body needs to be told what to do.
Right.
Nothing happens on its own. And so when we inject it into the scalp in a variety of different locations that, typically where people have balding, when we talked about male pattern baldness, for example, we concentrate on those areas so that those growth factors will tell your body to form new blood vessels to nourish the hair at the base.
Interesting.
Yes.
So who is the ideal candidate, and when is it not too late to start the procedure?
So, when men that have hormone-related hair loss, if they're in the earlier stages, the earlier start, the better, because we want to improve the hair flow to those follicles. Now, if you're in a very advanced stage, like you're shiny bald, it's way too late at this point, because that's too much hair loss. But, in order to get transplant nowadays, even a lot of those centers are wanting or requiring PRP injections first, to really maximize the effectiveness of those transplanted hairs.
Oh, that's interesting.
Yes.
So when you say shiny bald, and when you say this, it should be done as early as possible.
Yeah.
Like, what is the just to look at it? जैसे हम अगर किसी को देख रहे हैं, क्या उसकी इंडिकेशन है कि उनका स्कैल्प दिखना चाहिए या अगर ऊपर से sometimes this is the pattern, this is the area where you lose it the most.
Right.
So just by looking at the patient, what is the telltale sign?
So, in the areas where you're receding, you're starting to recede over here. Of course, the very common is on the crown, the crown here. When you start that thinning, again, if you want to start acting at that face, or even sometimes people have diffuse thinning, and that's why a lot of times women are really great candidates for this because they typically don't have the full. Most women don't have that full male pattern.
They don't have receding hairlines and stuff like that. It's just वो आहिस्ता आहिस्ता करके जो है वो पूरे ऊपर के area में they start losing hair.
Losing hair, it's a diffuse.
Right.
And so a lot of women, for example, they have their part line is starting to get expansive,
Right. That's a good telltale sign. If you're parting your hair और आपको जो आपकी मांग है वो बड़ी होती भी नजर आ रही है with time, that means that's a sign that you should probably get a PRP.
Start getting treatment at that point because again in that stage, if you're getting 20 to 30% increase of follicles or thickness, then it's a win-win situation for you.
Absolutely.
Now it doesn't work in everybody. See, this is the thing. There's no guarantees with these treatments. It's a very individual thing. Like where if in some people it'll work really fantastic.
Depends on your body.
Yes. Now. The thing what I tell people is that you're still not in a losing situation, that even if, let's say, it doesn't necessarily increase the amount of growth, it is going to create increased blood flow to your hair. So what's going to happen is that at minimum, you're going to have healthier hair that you already have existing. So it may slow down your hair loss.
Okay.
So don't ever just take it as like, oh, this was a waste of time and money and all this treatment was for what? Like I didn't get thicker hair. But you don't know how much it may have slowed it down.
Right. All right, so next question would be the cost. What is the average cost of these treatments?
So, it's going to obviously be very clinic dependent, but on average per treatment, maybe about $600 per treatment. Initially, we recommend a series of 3 treatments like this, so once a month.
How far apart? Okay,
so once a month times 3 months initially to really kickstart it. A lot of times you'll have 80% of the growth that you would be expecting within the first 6 months, and then the other 20% in the remaining 6 months, so at about a year time frame. Because see, the part with spending money for this and what I tell people is that it's very hard for you to tell, but it's because it's over time. It's like waiting for grass to grow. If you were to sit there and watch it every day for your grass to grow,
Right.
You're going to get frustrated.
Right.
But it's a long-term effect, and a lot of times I'll tell people on the yearly basis at least do 1 treatment because
for maintenance
and aging is constant, right? Hormonal activity is constant, so you're fighting your body constantly. If you have hormone,
you define time.
Exactly.
Right.
So that part doesn't stop. So just because we treat it doesn't stop. So even though I say 20 to 30%, if that hormone is still attacking those hair follicles, well, yes, you're going to have more hair loss. So you're really trying to slow down. And some people, it does a great job of filling in like empty spots on their scalp, like in women, in the part line. But again, these are things that it's like watching grass grow. So it's
right. And I think if I'm not wrong, it's an average person grows a centimeter of hair every month, and it's not the same for everyone.
Right.
So it could be slower or faster for somebody. So yeah, it may take longer than usual for some people.
And see, that we're talking length, right?
Right.
So what I'm talking about is actually diameter of hair. So the thickness of hair and the number of follicles, because that's what really constitutes how dense your hair is going to look, right? It's how many actual growth follicles you have, and then if each follicle itself is nice and healthy and thick, because we've all seen those people that have very thin hair. They may have a lot of follicles, but they have very thin, so it looks wispy and it doesn't look healthy.
Yes,
right?
yes.
So that's the difference.
Absolutely.
Yeah.
Okay, so my next question would be the aftercare maintenance.
Yeah.
What should you expect to do once the treatment's done? When you go home, how do you maintain it?
Okay, so this you can do even, let's say, even without treatment, like where in general, what's a good idea, and the funny thing is that, when I was growing up and my mom would say, it's coming to this country, losing hair, it's so rampant, back home we don't have this because we're doing these oils and things. And, all those things are extremely important. Nourishing your hair
Yes.
is extremely important. And we always...
Because it's a live part of your body.
Yeah. And, you always poo-poo those things because it's always like, okay, that's a small village recipe of things. But as it turns out, with so many different health and wellness things nowadays, we've realized that our sciences from back home are quite advanced, and now Western medicine is catching up with, like turmeric,
That's
for
amazing.
example. Yeah, right?
Yes.
So it's amazing. So, at that time I remember her this saying, like, stop using these, generic shampoos and stuff. It's toxic to your hair. And I was having, like losing extra hair like that. So one of the things that I recommend to people is really spend that extra money and get phosphate-free, sulfate-free shampoo, because those regular shampoos, especially the ones that create a lot of suds, that's when it's a lot of phosphate and sulfates in there, and those are toxic to the hair follicle base. There's specific vitamins, for example, biotin, Viviscal. Those are very nourishing to the hair follicle.
Right.
And there's a lot of laser therapies, not just lasers that I'm talking about, like what we do in here, which we can get into sometime later for skin health, but actually there's a specific brand name, for example, called Theradome, and there's different laser treatment for hair, but you wear it on your scalp, and it actually helps create a type of heat and light that at the base is helping that hair to grow. That could be $1,000 or $1,500 investment, but using that on a daily basis really
So you
helps
can actually
nourish.
buy at home and keep it at home and do it?
Yes.
Okay, that's interesting.
Yeah, and it helps slow down or prevent hair loss. So it's something good to have for a lot of people, that, especially if they already have genetic predisposition, parents, have hair loss and all. It's something I would invest for my child early on, if that was a...
Well, I'm taking a note down after the show
Yeah.
to make sure I have that.
Yeah.
Awesome, great. तो जनाब अब होता है वक्त एक ब्रेक लेने का. ब्रेक पे जाने से पहले हम आपसे हमेशा एक health fun question पूछते हैं. The question for today is, which is the largest organ of human body? हमारी बॉडी का सबसे बड़ा आज़ा कौन सा है? इस सवाल का जवाब हम आपको बताएंगे इस ब्रेक के बाद. Stay tuned. Welcome back. You're watching Health Talk with Nashin Mulbrad. ब्रेक में जाने से पहले हमने आपसे सवाल पूछा था कि हमारी बॉडी का सबसे बड़ा आज़ा कौन सा है. इसका आंसर है स्किन. और जहाँ स्किन की बात हो रही है तो वहाँ हम डॉक्टर साहब से ये मालूम करना चाहते हैं कि क्या स्किन एज और एक्चुअल एज में फ़र्क होता है या नहीं. Is there a difference between actual age and skin age?
So there can be, right? There's some people that age appropriately to where they are in life, but we've always seen that person and we're shocked with their age because they look a lot older than they're supposed to be based on their age. And a lot of that has to do with skin health and skin care. So, with the more exposed you are to sun, for example, and not using sunscreens, does skin damage and is going to prematurely age you. If you're a heavy smoker, again, smoking constricts blood vessels, which reduces blood flow, which is going to age you faster. If you haven't used proper products on your face to moisturize, because hydration, whether you drink a lot of fluid, drinking lots of water daily, or hydrating your skin through topical, all these things will improve your skin age. And so there's people that are well into their 70s that may still look like the 40s. Yeah.
Yes, absolutely.
Yeah.
अच्छा ये बताइएगा कि हम जब एजिंग की बात करते हैं और सन डैमेज वगैरह की बात करते हैं, so what are the some of the aging signs that you see usually in your clinic?
A lot of times you'll see excessive wrinkling in the skin because of the way the collagen production reduces over time in general, but with sun
Around
damage.
what age it happens?
Actually, surprisingly enough, you start the aging process in your early 20s.
Oh wow.
Yeah,
Okay.
and so a lot of times, people are starting their treatments even their mid to late 20s because they're realizing that the earlier they work on their skin health, the less damage that they have to undo. So, there's a lot of, especially if we look at social media, a lot of young women take flack for starting, let's say, their Botox or fillers, or even like a lot of the other treatments we do, like PRP for the skin. And they're like, oh, you still look beautiful. You're 25, 27. Why are you doing this now? Well, they're not waiting to look like their mother who waited, and then it takes so much longer to start looking well again because you have to first undo all that damage before you can start looking good again. So, and I'm not saying everything is appropriate for the early ages, but there's a lot of skin health that is important if you start early.
So the earlier the better.
Yes.
So what are the other signs beside wrinkles that you see, like aging signs?
So you get increased pore size, you get fine lines, and spots. A lot of sun damaged spots. So, with a lot of us that are darker skinned, it's not as apparent. But if we even in our Indian or Pakistani culture, if we have very light skinned people that have freckling,
Yes.
those are all sun damage, and we have ways to treat that sun damage with lasers here in this clinic.
अच्छा जी, अब आपसे हम ये जानना चाहेंगे, what is microneedling and who's the ideal candidate for that?
So microneedling is for skin health, and so it's basically like a tattoo gun, and but it's not tattoo. Obviously, we're not putting any kind of inks into your face. But anytime your body gets injured, it wants to heal itself to its best self. Okay, and so we have to. This is controlled injury. It's called. Obviously, we're not going to injure you in a way where you're scarring. We actually are using it all over your face in different depths. Basically, the pen looks like this. This is the microneedling pen. We have a cartridge up here that has tiny needles on it, and we control the depth by rotating this. And when we needle your face, what happens is that by creating those little pores and injections, you're creating injury in the layers of your skin that gets stimulated to heal. So what happens is that normally, if we were to do nothing else, if we were only to microneedle and we do bleeding, we gauge it on how much we get these tiny little blood ducts. When we create that injury, your body gets signals to say, hey, I'm injured, I need to do something to heal. And that's when your platelets come there naturally from your body, and they'll open up like we talked about earlier. The growth factors will be released, and those growth factors tell your stem cells in your body. So our stem cells in our body, which are cells that can turn into anything, they live in our fat, they live in our bone marrow, and it recruits to that area to say, I need more skin tissue and production here. So it gives you this really nice, healthy, glowing skin, and it starts increasing the skin health because it'll reduce fine lines, that big pores that it looks like on your face. All those things start getting reduced with microneedling.
So is it same as the derma roller you get to use at home, or is it different?
So derma roller is a good way to, between microneedling sessions, it's a good way to stimulate. And same thing, speaking of derma roller, that's one of the other things when we talked about the hair segment, we do recommend derma rolling on your scalp to create that trauma, because the longer the trauma exists, then
the more blood
healing.
flow you have and the more healing's going on.
Healing happens, yeah. So, but you're never going to be able to derma roll yourself the way we do this, because first of all, you have a self-protection mechanism. You're not going to injure yourself the way that it's supposed to be injured.
And it hurts. I've done that.
Right.
It hurts.
Right, yeah. So you're going to protect yourself. You're not going to do it the way.
Yeah, and you guys probably numb it before you.
And we can numb it, yeah. So we can topically numb. Some of our more painful procedures, like our when we do the scalp, we even offer laughing gas, to make you most relaxed, because the scalp one, we didn't discuss it, but it has to be a bit painful because we want to create enough injury for that blood flow.
Right,
okay?
and if it's not painful, it's not doing a better job at healing. Is
so,
that true?
So not exactly that. So
Okay.
in your face, we don't need to be painful. We can be gentle,
Okay.
but firm. Okay, we want to
Oh,
create that
okay.
trauma. But with the scalp, we literally have to create a level of injury that is
It's deep enough
it's
to-
deep tissue. Yeah, that's where it
Right.
is. And the deeper layers, it needs a lot more injury because this is surface. Microneedling is more surface tissue. The scalp is a much more deeper tissue where when we're injecting, we are creating injury. So with that one, we do laughing gas. With this, we do topical numbing, and it's comfortable. And in fact, when we talk about later on, we'll have different options as well. We'll show you.
Awesome. So who's the ideal candidate?
So as long as you're an adult, you don't have to wait for your skin to wrinkle because this is maintenance or skin health. So if you're going to the salon to get your nails done and hair done, you can come in for microneedling and it helps grow. Now, when I said that, usually you don't really start the aging process so much until you're about in your early 20s because that's the initial start. On average, if you want to start working on your skin health, you can't start as early as your early 20s.
Okay,
Yeah.
all right. So my next question would be, what is the average cost? I know every clinic charges different pricing, but what is the market average right now if you go into for a microneedling session?
So there's again, like you said, it's different. It can range anywhere from $300 to $500 to $700 depending on what you're getting done because microneedling, there's microneedling alone, there's microneedling with a type of chemical called hyaluronic acid to PRP. So it depends on what you mean by microneedling because you always have to have it, okay, microneedling with what?
Got it. So
Yeah.
it's combined with a different type of procedure and combined costs could be different.
Right.
And what frequency should one be looking at? Is it 3, 4? How many treatments should one get?
So again, when we're talking about skin health, this is maintenance, right? So maintenance, on general, it depends on everybody's budget, but ideally, if you are able to do something every 3 to 4 months, because the more you do this throughout the year, and again, you don't need it every month,
Right.
but every 3 to 4 months, if you get a treatment like this, it's good for your skin glow, how healthy it looks. So yeah, on average,
look
3 to
more
4 months.
fresher and glowy.
Yeah. Because the whole idea is that what we're trying to avoid is necessarily having major surgery later on. The more skin care that you do early on, you want to age gracefully. That's what we want is, people to age gracefully and to also instill confidence in them. We're all about creating that feeling of wellness inside as well as, and a lot of that has to do with how well you're feeling and looking on the outside.
That's true. We want to know what is the downtime because जब आप microneedling का procedure करते हैं and you're technically injuring the skin.
Yeah.
So can I just go home and go about my day or is there a downtime? Can I wear makeup after that?
So usually it's for a day that we don't want you wearing makeup. It's considered an open sore on your face, right? Because we've needled your entire face. So that day you want to take it easy. You can still carry on it at home. It's just more that how comfortable you are outside. We want to have absolute clean environment though. So we do recommend that you clean your phone with alcohol. We don't want you touching your face with it. We don't want you constantly touching your face, and we don't want you necessarily in the gym where you're sweating. Again, it's all these things are more infection risk rather than your downtime. You can carry on with your normal activities, and then the next day, 24 hours later, you can start wearing makeup and all again.
Time for a break. Break से आने के बाद हम बात करेंगे माइक्रोनीडलिंग विद PRP क्या होता है उसके बारे में आपको देंगे इन्फॉर्मेशन. स्टे ट्यून्ड. वेलकम बैक टू हेल्थ टॉक विद नाशिन म्यूलब्रैड. जनाब, ब्रेक में जाने से पहले हम बात कर रहे थे स्किन और माइक्रोनीडलिंग की. डॉक्टर AD ठक्कर हमारे साथ मौजूद हैं और हम उनसे जानेंगे व्हाट इज माइक्रोनीडलिंग विद PRP. यस डॉक्टर.
Okay. So, when we talked about microneedling and we create injury, naturally our own body's response is to send your own platelets there, right? So, because that's what stops bleeding and also then has the growth factors to have healing happen. In that healing, in our skin especially, it's all about production of collagen and elastin. Collagen and elastin is between our cells that gives you that youthful look. When we get older, our body stops or slows down, I should say, the production of our collagen and elastin. So collagen is the main thing that kind of binds all our tissues together. And that's why as you get older, you get wrinkling because there's not enough of that tissue underneath. It's the same reason a lot of times, especially in our culture, that we get the dark circles under our eyes because
Yes.
that fat and the collagen production is reduced, and so the dark circles are really, you're seeing your blood vessels underneath and the darkness of those vessels. So the same thing is with skin. So when we use PRP, when we talk about PRP, again, I'm going to say it again because it's a difficult concept sometimes to understand right away, but platelet-rich plasma. And it's because we take your own blood. This is what you're not going to get infected with anybody else's blood. We do it on site that same day. We take your blood and we have a machine here that we spin down and we get that plasma and platelets only. It's not the whole blood, it's just that portion that's going to help your skin. So when we take that concentrated plasma and platelets and we put it into the area where we're microneedling, it improves the amount of platelets and increases the amount of platelets about 5 to 7-fold, right? So what happens is that if we were just to microneedling, yes, you get a good result. But if you want to increase that result and you have more collagen production, who doesn't want more collagen production, right? We want as much collagen as possible to reduce the amount of wrinkling that we have and that youthful appearance. So some of you may have heard this as vampire facial.
Yes.
And so in that, the reason it's called vampire is because we're using your blood. So it's kind of like vampires suck your blood. We're going to first suck out your blood and use it to help heal you. So there is the way that vampire facial traditionally is done is when we microneedle somebody, it's not just dry. We have to moisturize your face as we're doing it. And so when we only microneedle without blood product, that is a substance which is called hyaluronic acid, which is present in our body, but it helps hydrate the skin. It plumps up your skin almost like a gel.
Right.
And so when we do a hyaluronic acid, which is in a lot of skincare products, it's really to help internally moisturize your skin to hold that water.
Right.
So when we do it with platelet-rich plasma, instead of using hyaluronic acid as a vampire facial, we're spraying that plasma that has the platelets in onto your face, and then the microneedling in, so that basically we're relying on the holes that this tattoo gun-like type action is putting into your face, and it absorbs that way. But in that, you only get about 20% to actually enter your skin. That's the traditional vampire facial because it's so loose and liquidy that a lot of it is dripping off. Now it's still good. 20% is still great if that's what you want, right? But the way we think of it is, if you're going to pay for a vampire facial, why don't you go to a location that has a increased absorption of that plasma?
Right, so you're not really wasting the product. Yeah.
Right, yeah. If you're going to have your blood drawn, use
Right.
all of it, right? So we have a device here that most clinics don't have, and we call it the BioBrush. And so instead of just spraying that plasma on your face that has the platelets, there's a chamber here that we load all that plasma into, all right? And then when we put this on your face, there's a wheel here that as we're rolling it onto your face, there's these tiny little needles that actually, in a sense, micro-inject that plasma back into your skin at the depth where the collagen is produced. So as we're doing this, a lot of times we'll only have maybe it's 10 mLs that we put in here. Maybe if we lose 1 to 2 mLs, that's a lot, but the vast majority of it we actually get into your skin. So instead of only 20% going in, our device will get 80 to 90% of your plasma into the skin where it needs to be to help that healing process.
Interesting.
On top of that, there's a chamber in the back here that collects that wasted plasma, and we don't actually waste it. So when we microneedle afterwards, we will still use that quote-unquote wasted amount and inject that into yourself. So we want to get that plasma with platelets maximally into your skin.
इंटरेस्टिंग
Yeah.
ओके जी कई सालों पहले तो हम जो लफ्ज़ सुनते थे वो था बोटॉक्स और हम ज़्यादातर तो मूवी स्टार्स को लेके ही ये वर्ड सुनते थे लेकिन आजकल बोटॉक्स एंड आई थिंक इट्स कॉल्ड डर्मा फिलर्स दे आर वेरी कॉमन सो आई वांट टू नो व्हाट्स द डिफरेंस बिटवीन बोटॉक्स एंड डर्मा फिलर
It's quite different. Botox, being a toxin, is a paralyzing agent. So a lot of our facial reactions cause a deepening of the wrinkles on our face because as you use those muscles a lot more, you start getting grooves.
permanent lines या wrinkles इसी तरह ही होती हैं
Right, yeah. So the wrinkling is one aspect of it, and then those permanent lines, like you say, is something else because of all our facial reactions. So the common ones are the forehead lines,
right
the number 11s, as it's
laughing
called.
lines like I have
Laughing lines.
yes
And so that area actually, those are those are related to expressions, but that actually those become deeper. These marionette lines, as it's called, those are from actually loss of collagen, which is not
interesting.
some of this is also loss of collagen, but this is a lot of expressive lines. So the three main locations of Botox is your crow's feet, as it's called, which are
Right.
the laugh lines here. The number 11s because you get these deep grooves here, and then the lines
The
across our forehead.
and
from
the older you get the deeper they become
right.
and tougher to I guess get rid of
Get undo, and that's why
Right.
a lot of women, even we have clients that are in their late 20s,
Right.
early 30s that are doing it because they're not waiting for that deep grooving to set in. They're doing it early. And when we paralyze those muscles, we want to do it here as naturally as possible because
right
we
you don't
want
want to look like a fake doll or something you want to look
Yeah.
as natural as possible
Yeah, it's important to still have your expressions, right? I mean,
Right, yeah.
you don't want to look frozen.
Right.
Yeah. I mean, you don't want to look like a mean person because you can't smile. What I mean?
Right.
We want you to have those laugh, but we want to do it where it's relaxing those muscles,
Right.
so that it relaxes those grooves as well.
right
Now, fillers is, again, when we talk about fillers, it's a quick fix as far as the other things that we were talking about with microneedling and PRP, is because with those treatments that we just talked about, we want your body to produce the collagen.
right
With fillers, it's taking the place of your collagen. So, if you have those hollows in very specific areas, I mean, you can't just put fillers all over your face. I mean, you can. There's different techniques that are out there to really get rid of a lot of the hollows. But, in traditional places where people want some increased plumpness of their
Lips.
upper lip and they want to get rid of the deep lines that are over here, we fill it instead of collagen is putting that in there, so it creates a moisturized internal filling to fill out that void, that
Right.
absence there.
So my question would be, अगर किसी की skin is it like you do microneedling first, and if those wrinkles and lines are not going, or microneedling with PRP, then you try the derma filler, or the candidates are different? You look at them and you're like, okay, microneedling with PRP may not work, so derma filler is the way to go.
So, again, I'm trying to separate these things into
Okay.
two different procedures altogether.
Okay.
One is skin health and maintenance.
Okay.
So those are never the wrong answer because you want to stimulate your skin as much as possible all the time to get maintenance treatment because you want to still produce those things. But if you have a wedding next weekend, you're not going to produce enough collagen to look better by
There
next
you
weekend.
go, that's- yes.
Yeah, these are quicker fixes because people want to look better now. They're not waiting for the future. They're not-
Instant gratification.
Instant gratification. I mean, we
Yes.
have an instant gratification
Yes.
society, right? I mean, so there's different fixes for different things, but in the long term, if you want to stay looking good and you want to not have to rely as much on fillers, because there are times where, patients can do enough of their own collagen production that how much filler they may go down over time.
Right.
That's the goal.
So it's more like derma fillers like a band-aid. You're getting a temporary fix, and after that you really need the maintenance procedure to go in the long run.
Yes, because a lot of people want instant gratification, so we need to be able to treat them now. And if you have an event coming up next weekend, you're not going to have enough time to produce your own collagen. You need the fillers to take the place of that collagen so that you can look good now.
Right. Well, thank you so much, Dr. Thakkar. It was such an informational सेशन वी हैड टुडे एंड आई होप हमारे व्यूवर्स को भी बहुत फ़ायदा होगा इस सारी इन्फॉर्मेशन से. थैंक यू फॉर कमिंग टू द शो.
Thank you so much for having me. It's been a pleasure.
थैंक यू. यहाँ हम आपसे लेते हैं इजाज़त. याद रखिए कि अच्छा दिखना और अच्छा फील करना आपकी मेंटल हेल्थ के लिए बहुत ज़रूरी है और आपकी फ़िज़िकल हेल्थ का डायरेक्ट ताल्लुक आपकी मेंटल हेल्थ से है. अपना और अपनी फैमिली का बहुत ख्याल रखिए. अपने सजेशंस और अपने कमेंट्स हमें भेजिए info@vosa.tv पर. अगली बार आपसे एक नए टॉपिक के साथ मुलाकात होगी. अपना ख्याल रखिएगा. गुड बाय.